One concern of new parents is when a child is diagnosed with a urinary tract infection. That condition could lead to an even more serious medical problem requiring surgery. Rod Starnes joins us once again with a look at how some families are now avoiding the OR thanks to an innovative liquid developed on the cutting edge.
Urinary tract infections, or UTIs, are fairly common in children, more common in girls than boys. But there is a related condition that can cause major stress for the entire family.
Our daughter Elizabeth was really sick. She was in the hospital. She had 106 temperature. They found out that she had a urinary tract infection, and that caused a kidney infection. And then we found out that she had something called urinary reflux, and we were really scared.
Elizabeth was diagnosed with vesicoureteral reflux, or VUR.
Basically what that means is the drainage tube that carries urine from the kidney to the bladder really only allows the urine to pass from the kidney into the bladder. It is not supposed to allow urine to go from the bladder back up to the kidney. And when that insertion of that drainage tube into the bladder is faulty, then urine can freely flow backwards, if you will, from the bladder up.
The physicians told us that we had three options. The first option was a long course of antibiotic treatment, and we intuitively did not want our daughter on a lengthy course of antibiotics. They then told us that they had a high success rate with surgery, but we were not excited about the prospect of surgery for a 12-year-old girl. She would have had to have been in the hospital for a week and then another week home recuperating.
But a new treatment called Deflux is offering parents a third option.
It's a gel-type material. It comes in a small syringe, and it's injected through a needle that fits through a telescope that is placed in the child's bladder. We inject this gel material into that ureter tube and functions initially as a bulking agent to create essentially a valve mechanism that allows the flow of urine into the bladder but not back up.
While this new procedure is still surgery, doctors describe the difference as night and day. Instead of a 2-hour operation and a hospital stay, the Deflux injection is done on an outpatient basis.
The procedure lasted about 15 minutes, and I was in the waiting room, and the doctor came down and told me to go up. I went up to see Elizabeth, and she was in the recovery room. She was doing really well. She was alert, and she told me she felt fine. She didn't have any pain. We went home, and that night she was up and about. She didn't have any pain at home. And that weekend she was playing soccer, so it was really wonderful.
It is a great sense of relief to know that you can deal with this problem in a simple and straightforward way with limited follow-up, and it's basically behind them.
It's cutting-edge science, allowing parents and children to get on with enjoying their lives. For Smart Medicine, I'm Rod Starnes.